Hawaii's health insurers say they will cover COVID vaccinations for anyone older than 6 months, despite new FDA guidance that says children and healthy adults don't need the shots. While public health advocates applaud the decision by Hawaii's insurers, doctors and pharmacies are predicting a big drop in vaccinations. Our Daryl Huff explains.
We heard from all Hawaii's major locally owned insurers, HMSA, Kaiser, UHA, and Aloha Care, and all said they will not change their policies and will cover COVID vaccinations at no cost for everyone 6 months and older, although some say a doctor's recommendation may be necessary.
Well, I think that the insurance companies are acting in good faith in our state, and I'm grateful for that.
Hawaii insurers are mostly keeping prior vaccination policy, despite high-level controversy at the Centers for Disease Control, different and more conservative directions from the FDA, and mixed vaccine statements from Health Secretary Robert Kennedy Jr. But providers expect the chaos will chill people's urgency to get vaccinated.
Is going to cause at least in our state, probably 30% less individuals seeking vaccinations. And I would put the number at 50% in most states across the country.
Dr. Scott Miskovich is a big advocate for faxing and testing for COVID, so his premier medical group was committed to ordering a hefty supply of vaccine that costs more than $200 per dose, even though he fears for those who won't come and get it.
I'm really concerned about the 50 and under age group that have things like asthma or obesity or diabetes that are at risk, and they're not going to get them. And those are the people that could get COVID and be hospitalized with severe complications.
Insurers only reimburse providers for shots and arms, not unused inventory. So there's a risk.
The cost of 10 doses is, anywhere from $1,200 to $1,400. So that's something that, especially the smaller offices and businesses can't absorb.
Dr. Corey Lejano is still trying to figure out how much of the vaccine to order for his Mauliola pharmacy on Maui. That will depend on specific instructions from insurers and a guess of how many people will come for shots.
Even last year, we weren't able to utilize all of our stock, and so we did end up losing a good amount of money because of the vaccines that we had on the shelf that just weren't administered. And so there is a steady decline.
Picture that dilemma extending to pharmacies and doctors' offices statewide, which could mean less vaccine is available here, which may leave patients having to shop for their shots. Daryl Huff, Hawaii News Now.